Hello, my name is Ricky Palomo. I am the Neurological Rehab Coordinator of Emerge Nursing and Rehab. Today, I wish to discuss challenging behaviors and how we at Paragon help with managing them so that our patients are safe and are able to make progress in their rehab. When a person suffers a brain injury or experiences a trauma that causes emotions to run high, we will sometimes see them display acts of challenging behaviors, which can include examples of shouting, crying, agitation, not accepting care, attempting to perform tasks without assistance, or even aggression. It's important to note that all behaviors are a form of communication. It's up to the team at our Paragon facilities to determine what our patients are attempting to communicate when they are presenting with a challenging behavior. Please join us in a discussion with some of our team members who are trained at de-escalating behaviors to keep our patients and the staff members safe. So let's meet the team. Here we go.
My name is Lisa Fondas. I'm an occupational therapist.
I'm Rosie Torres. I work in the bakery.
I'm Sabrina Cadigan. I'm the therapeutic recreation supervisor.
Thank you guys so much for being here. We are going to be discussing different scenarios of different patients and hypothetical challenging behavior situations. I want you all to describe to me in your role what you would do to help de-escalate those behaviors. Here we go. Here is the first one. Ruth is a 74-year-old woman who suffered a left side stroke 5 weeks ago. She is able to walk with one skilled professional assisting her, but without assistance, she is unbalanced and uncoordinated. Due to her stroke, she has increased confusion, often searching around looking for family members as she believes she is at her house. In this example, she is currently in the day room with other residents and she begins standing from her chair. Can you please tell me what you would do in your role?
I would redirect Ruth back to her chair and I would set her up with an activity of choice, whether it be coloring or a craft or even a book.
Now, how would you know what Ruth liked?
Upon admission, we often ask the residents or the family members what their hobby is, how they occupy their time at home.
Very good. Amazing. So you know exactly what's going on. My next question, though, is she might be looking for a relative that's not in the building. So can someone please tell me if that's what she needs and she won't react to the coloring book, what would be the next thing that you would do? Can you tell me?
Sure. So obviously we want to prove to her that nobody's here.
Right.
So we want to bring her to show her, let me get you in your chair and let me bring you to see where we are again, refamiliarize herself and see that nobody's here right now. Maybe even call the family member that she's looking for so they could say they're on their way or they're going to be coming there soon.
Very good. I love that too. Now, I think that that's very good for this particular person. I would love to move on to the next one. That means you're up next. So, let's go to this. Tom is a 48-year-old man who last month fell off a ladder and suffered a traumatic brain injury. He presents with increased confusion and sometimes hallucinates, claiming he sees people or animals that are not there. Currently, Tom has an out-of-bed schedule where he gets to nap every day after his therapy. While you are doing your rounds, you hear commotion coming from his room. Tom is attempting to get up from the bed. He is getting agitated and pointing to the corner of the room, saying he wants the dog to get out. A certified nursing assistant is attempting to calm him down, telling him nothing is in the room, but he is still agitated. So if you saw him and you saw the aide trying to help him, what would you do to help de-escalate?
I would go in and try to die down the situation by not yelling, of course, just trying to calm the resident down, okay, we'll get the dog out, no need to be agitated, because if we get agitated, the dog will stay here, but pretty much, I would kind of engage with it, but also it will also calm them down, to make it seem okay, we're gonna get the dog out, everything is gonna be okay, there's never need to be so agitated or even get aggressive with the resident, or lose patience, because we're here to help them pretty much. So even if it means that we have to pretty much feed into it a little bit.
Yeah.
But that's what I would pretty much do in any situation like that. I would just okay, you know what? Let's take a deep breath. Let's get back in our chair or in the bed. We don't want no accidents happening. and we'll remove the dog from the room, and you'll be by yourself, calm, and continue on with the day.
So sometimes that confirmation is all a person needs to get more calm. They are already uncomfortable and someone is telling them that they're wrong about something. When we have a brain injury, our judgment can be off. And so sometimes that empathy is the thing that connects you to that person, can de-escalate that situation. Now, if you guys entered that room and the TV was on and blaring, the windows open, it's a windy day, and the aide is struggling and there's a lot of commotion outside. Can you guys tell me what else can you do to help further de-escalate? Jump in.
So there's something called overstimulation. If there's a lot of commotion, noise, lighting that is bothering a patient, a resident, or the situation in general, it could make your reactions enhanced and make you feel overwhelmed. So the first thing I would do is shut off the TV, maybe close the door so not as much noise, and really try to just calm the situation, because that could also be causing why the hallucinations are getting worse, because he's overwhelmed.
Yes. I love that. I think that's fantastic. So from this example, the best takeaways that I'm getting from you guys are be empathetic, be respectful, and if there's too much going on, reduce the stimulus in the room, because that inherent calming sensation could be exactly what it's needing to go into that final de-escalation. Yes. Very good, guys. Now we're going to work on the third one, which means that they answered, you're up. Here we go. Michael is a 60-year-old man who was in a motor vehicle accident resulting in a spinal cord injury. This injury has left Michael requiring total assistance in all forms of care, as he has extreme difficulty with basic movements of his body. Michael often shouts and is verbally abusive towards staff. He denies his medications frequently and is inconsistent with his schedule, moving appointments and denying therapy throughout the day. You are currently with Michael as he is shouting and does not wish to leave his bed, take his medications, and he will not do therapy. So tell me, what do you think you should do to help the situation?
Although Michael is able to make his needs known, Michael also needs to be able to know that his needs are heard by staff. Michael needs reassurance and compassion.
Yes.
And we want to bring that to him. We want to make him understand that we are listening and we are here for him. And maybe Michael just needs someone to sit down and listen to his needs.
I think that's a fantastic answer. Again, compassion, empathy, patience. Now, sometimes it's hard in that initial reaction when someone is so angry. Even if they didn't suffer a brain injury, their emotions are running so high that it's so hard to bring someone back down, me included. So, yeah, tell
I'd
me
like
what you
to
do.
jump in. Sometimes after an injury that you've gone through and now you're in a facility and you're young, sometimes you are overwhelmed with the acceptance of this injury as well, and you're taking that out on staff. And I've worked a lot with staff, you guys too, with don't take what is always said to heart. And remember that they're getting their frustrations out. And sometimes we just have to be that punching bag, because we're there to help get over that hump so they can get into the next phase of the grieving, to understand that this is accepting of who I am now.
Definitely want to make a note, emotional punching bag. Please don't ever be a physical punching bag.
Yes.
We'll call in for help.
Yeah,
I
no.
think it's worth mentioning that we have to make sure that we call for help if we require it, gently, with reassurances, but we don't overwhelm that person with a bunch of people running into the room we just make ourselves look like they have enemies now. So we want to make sure we're de-escalating in a very calm way. So let me ask, and I'm going to ask you now, if all measures fail with Michael, and that anger is not de-escalating, but he is staying in bed and he is safe, do you think reattempting later would be a good option?
Yes, I do personally. I always, whenever I'm in a situation where I see the resident is still not calming down or anything, I always let them know that I'm going to step out. I'm going to come back in a little bit. You can calm down. If you need anything, let me know. If it helps you to calm down. And always come back and be all ears to listen.
Yeah.
And pretty much it always ends up working, because they end up calming down and then telling me what the situation is and why they got so agitated and
Yes.
so loud the way
Yes.
that they did. So pretty much I really do agree with just like, coming back and letting them calm down,
Mhm.
But if it gets to a point where like, they are showing a little signs of aggression, I'm like, okay,
Yeah.
I'll step out, I'll give you your own space, It's never no need to like hurt anybody,
No,
We
yeah,
understand you're frustrated,
Yes.
We're here to help, we're here to be all ears, You're not alone, pretty much,
No, I think these answers are all perfect. We can reattempt later as long as we know that that person is safe. Sometimes the worst behaviors come from people that are in the most grief, unable to accept what's happened to them. Thank you guys so much for this.
Of course,
Thank
thank
you.
you.
From these examples, we see that challenging behaviors manifest in many different ways and for many different reasons. It is important to note that when approaching someone who is having a behavior, we must be respectful and put their safety and dignity first. At Paragon, we prioritize education of our team so that they are calm and able to handle a wide array of challenging behaviors. De-escalation and redirection techniques help keep our patients safe and have better outcomes.